Hello, I'm Bob Watson, President of Patient Education Concepts. This short webinar will give you a brief overview of the Lens Scatter Counselor that is now available from PEC to help you explain how a patient's objective scatter index, or OSI, can affect their vision. The Lens Scatter Counselor was created with the support of AcuFocus Incorporated and Visiometrics Incorporated and intended for practices that use the AcuTarget HD Instrument or the Visiometrics HD Analyzer. It is now commonly used to screen presbyopic patients for their camera inlay and to educate patients about the 3 stages of dysfunctional lens syndrome and the surgical options available for patients in each stage. The Lens Scatter Counselor can be shown to patients while they hold the printout of their HD Analyzer results. However, instead of using the baby picture, we created 2 scenes to simulate vision that include a near, intermediate, and distant object. There's also a night scene that can be used to discuss ocular scatter's effect on nighttime driving. We also changed the clear to white clouding simulations used over the baby image on the HD Analyzer to a yellow to brown clouding over our images so that it is more representative of cataract development. Although OSI can be affected by poor tear film and other ocular abnormalities, the Lens Scatter Counselor assumes that these factors are not contributing to their OSI measurement. Before counseling patients, each practice should decide what the OSI threshold numbers are for the various corneal and lenticular procedures they offer. The Lens Scatter Counselor has 3 slider bars that you can use when counseling patients. This is the aging eye slider bar. This is the presbyopia slider bar. And the third link in the slider bar options you see here is the IOL Counselor, which I will demonstrate shortly. Now let's counsel a typical presbyope with an OSI of 0.7. So the counselor or the doctor starts by moving the slider bar to the position OSI 0.7 and says something like this. We performed a test that measures how much the lens inside your eye is affecting your vision. Each patient has a specific ocular scatter index, or OSI, which quantifies your quality of vision. This measurement helps determine the best treatment for you. Your OSI is 0.7, which means your overall quality of vision is good, but you're starting to experience some slight lens changes. This is likely due to presbyopia, which is causing blurry near vision. If you're interested in reducing your need for reading glasses, your OSI score indicates that you may be an excellent candidate for the camera inlay. We implant the inlay in the cornea of your non-dominant eye to provide you with an extended range of vision so you can see from near to far clearly. So the counselor then clicks on Compare to Normal to show how that near image becomes clear, and continues with similar to how you could see before you developed presbyopia. The same counseling session can be done with the presbyopia slider by moving the pointer from normal to presbyopia. Now let's do a sample counseling session with a little bit older patient, perhaps with an OSI of about 2.5. The counselor starts on the aging eye slider and moves the OSI to 2.5, and again says something like this. We performed a test that measures how much the lens inside your eye is affecting your vision. Each patient has a specific ocular scatter index, or OSI, which quantifies your quality of vision. This measurement helps determine the best treatment for you. Your OSI is 2.5, which means the lens is likely developing a cataract and is losing its ability to pass enough light to your retina to provide you with 20/20 vision. By clicking on the Compare to Normal button, you might say, if we remove the natural lens inside your eye and replace it with one of the advanced IOLs that we offer, it can provide you with near, intermediate, and distance vision and it will allow you to see similar to how you could see when you were younger. And if you decide to have a lens replacement procedure now, the counselor then kind of slowly moves the OSI slider down to scatter stage 3 and continues. You will not have to experience a progressive loss of vision while your cataracts continue to mature and become a medical necessity to remove at some point in the future. Let me show you now how some of the IOLs that we offer can help you see after your lens replacement procedure. At this point, the IOL Counselor tool can be selected. The Cataract Overview section allows you to explain cataract development, lens removal, and IOL implantation. The IOL Overview allows you to explain monofocal IOLs, multifocal IOLs, and extended depth of focus IOLs, assuming you want to have the extended depth of focus IOL element in this section. When placing your order with PEC, you'll select which of these IOLs you will want to be able to simulate on your IOL counselor. If you want to show how multifocal IOLs work, you can simply move the arrow along the bar to show normal vision, presbyopia, cataract development, standard monofocal IOL, this is a day scene, multifocal day scene, standard monofocal night scene, and multifocal night scene, showing the patient how some multifocal IOLs create rings and halos around lights and how they become less and less noticeable over time due to neuroadaptation. If the practice uses extended depth of focus IOLs, you can quickly show them how the extended depth of focus IOLs have less noticeable nighttime side effects than multifocal IOLs. You will also notice the IOL counselor has the narrative under the slider bar. When ordering the Lens Scatter Counselor, you can have the option of putting the IOL Counselor part of this program onto your website, thereby adding an interactive element to your website that will help pre-educate patients about your lenses before they come into your practice. The Lens Scatter Counselor can be displayed on tablets, laptops, and desktop computers within your practice. An internet connection is necessary to display the counseling tool. It is licensed per practice for only $199 a year. And again, if you want to use the IOL Counselor part on your website as well, that's just an additional $50 a year. To order, simply click on the order form button on this landing page, print and fill out the order form, and fax it to 281-583-0590, or scan it and send it to sales@patienteducationconcepts.com. You can also call 281-583-5577 to order over the phone. Thank you.